Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers. I'm going to be the facilitator for today's session. We have Evalyn Greb with us today, and she's going to be talking about creating a plan for today and the future. And I have seen the entire presentation, and there is a lot of information there. Hopefully, you'll be able to find that presentation in your inbox also if you registered for the call today. If you did not register and you need to get a copy of that presentation, you can reach our customer service representative toll free at 866-390-6491. So Evalyn, welcome to the session today, and tell everybody just a little bit about yourself before you get started on your presentation.
Thank you, Glenda. This is one of my very favorite topics, mental health and long-term care planning. And I want to tell you why. I have worked as a social worker. I'm a licensed clinical social worker in San Diego County. And I have worked in adult day healthcare, where I started my career when it was still being paid for as a separate service. Now you have to be in a special needs plan to get that. I have worked as a hospital social worker, started an emergency care response unit, started an inpatient hospice, first one in the county, and started a home health inpatient, which was cool because it was the nurses could actually follow their patients into the home if they both chose to do that. I have also done board and care work and done case management in people's homes and run programs for that. People who were eligible for nursing homes, and we kept them in the community with extra services. And the reason I'm telling you all of this is because here's one of the things that I've seen, just one example. When I worked in the emergency room and a couple would come in, the guy had just had a heart attack and he came in unresponsive. And after 15 minutes, 20 minutes, the doctor came out and announced that the gentleman was dead. Well, it was very sad. We did a lot of counseling around it. And the next day or the day after, family comes from back east. And they're hugging and kissing and loving each other until they start talking about the will. And the money, when money is not talked about before death, it is the one thing that separates families so badly. The other thing is, if this gentleman had lived but was disabled, his wife had absolutely no plan. She had no family in town. They were all back east. So what was she going to do? And I just want to say one more thing about that. If you go in the hospital and they tell you that your loved one is being discharged, you have the right to appeal and get 72 more hours in that hospital, so you have a little bit of time to make a plan. But isn't it better to have a plan in advance? So that's what we're going to talk about today. And I'll let you read these, Glenda.
Right. We always like to set up some objectives so you know what to listen for in the midst of the presentation. And so these are the objectives set up today, is to present a potential checklist for planning, provide links to relevant websites, and let me assure you there's a bazillion of them in this presentation. Discover the wealth and breadth of useful tools now available, not WCF endorsement. And that means that we aren't endorsing these sites and this information on these websites. We have to give that little disclaimer. And then our last objective is to inspire, hopefully, but if not, scare you into action starting today. So we're going to be on your case because we've been doing this a long time and have heard those terrible horror stories, haven't we, Evalyn?
Boy, we have.
Yeah.
So
what is start off with this one on long-term care?
Okay. Long-term care basically is a huge, broad spectrum of services and supports for persons with physical and mental needs. And I'm not going to read this list, but it's pretty much anything a person needs when they get functionally dependent. And they may have a disease, or it may just be that they broke their arm or broke their hip and they need some help. So long-term care could be short-term or it could be really long-term. Long-term care starts at 3 months after an incident happens. It's kind of basically how the government sees it. So that's that one. And of course, in the United States, we have no plan for long-term care. There have been several presidents, including Hillary Clinton and certainly Joe Biden, who have tried to put together a plan, but it's so horribly expensive because the caregivers are giving so much free care right now. But those who need long-term care, and you should, oh, you know what? I made some changes, Glenda. I'll have to send this out. I put a link to this study by the New York Times and the Kaiser Family Foundation, because what it actually says is those who need long-term care are more likely to die broke, 40% more likely to die broke. And this study really needs to be understood and read by people who are over the age of 50 or 60. And 20% of all older adults have functional problems. And that's, it could be they can't eat, they can't change their own bed, they can't get to the bathroom by themselves. So these are some of the, very problems that seem like, well, if they had a wife, they could be taken care of, right? But what if they live alone? And what if their family's not around? And 8 million US adults have dementia. And of course, dementia makes everything worse. It often requires, 24/7 supervision. And functional dependencies, and those were the ones I already talked about. You can't, maybe even take a shower by yourself. 3 million of those 8 million have no assistance at all. There's no family, they can't afford care. And because there's no coordinated plan, these are the people who often wind up in a nursing home on Medicaid, and you must go broke. It forces people into poverty. And what you need to know about Medicare is it does not pay for long-term care. There are a few small things I will mention on some of the forthcoming slides. Medicare pays for home health, it pays for hospice, but those are very limited services.
No plan. That's why we're here today.
So, right, if there is no plan, there's a crisis with sudden unanticipated changes. One of the things that'll happen, as in the case of, the hospital discharge planners, like you're going to get a notice on your bed next to your hospital bed, and it's going to say, we're discharging you tomorrow. And if you're the caregiver, you may say, wait a minute, I can't give him insulin shots. I can't help him walk. I can't help him transfer. I can't do that. And that's when you need to appeal and get that 72 hours in the hospital. The other thing that happens is when, like, for instance, this couple, if they had one had a heart attack and was okay and needed some rehab, how do you make that decision on the fly? Have you ever seen any of these rehab places? Do you know what they offer? Are there any close to you? Do you have any idea about where to find these resources? And the other thing is that what can happen if there's no plan is that caregivers are always worried about tomorrow. We hear that all the time. It's the stress level is so high. The risk of depression, it's almost 100%, over time, because there's always something that caregivers are worried about. And anxiety is high. What if I forgot to do something today? They try to be perfect. Caregivers are always trying to be perfect, and we're not perfect. We can't do everything. And the caregiver emergencies can just be disastrous, because if you're the caregiver and you don't have an emergency plan, what's going to happen if you're in the grocery store, you have a stroke, you don't know where you are, the medics come and pick you up, take you, they have no idea that you have a care recipient at home that's not being cared for. What happens in that situation? So, we just to go.
Like a lot of people need to be involved in this planning, according to the slide.
Well, I think that's true. And one of the reasons I'm saying that is those family members, who come together and love each other until they find out they're not going to get the family house, or because they haven't seen mom or dad for 30 years, and the people who were living with mom and dad actually have been providing care for 30 years. It's that kind of stuff. You got to involve them up front. You got to involve them in this planning. And it's really important that to start early so that the care recipient, maybe they're in a wheelchair, maybe they have MS, multiple sclerosis, and that they're going to need a nursing home. Wouldn't it be nice if they could go and see the nursing homes and see which one they wanted to go into when the time came, rather than you having to make a choice for them and not knowing if they'll be happy there. And it just seems like it would be so much better. And then there's always, this bottom one, the family disagreements. We've had many people talk to us. We had one great call where there were 6 adults living with their parents who were elderly, and and what they did was they fought all the time over who was going to do what jobs. And worse is when somebody says, well, I don't want mom or dad to go into a nursing home because they're going to have to spend all their money. And I want some of that money. I'm going to inherit some of that money. I don't want them spending it on a nursing home. You've got to keep them at home, but they're not willing to provide any care. So this is the time when you need a third party to come in, and you can have your pastor, you can have the hospital social worker, hire, a geriatric case manager. You can find one with your zip code by going on to this website, aginglifecare.org. So, where should we start?
Well, it looks like you've got a lot of resources here that will tell us how to get this going.
And this one, I think you could all do today. This is not overwhelming. This website, the Conversation Project, and there is a podcast that we have that was given by the woman who runs it. Very smart woman, works for a nonprofit health information system. And this link, I went on it and I used it for myself and I gave it to my family. And it is all about, who do you want to make decisions for you if you can't make them? Where do you want to go if you can't walk anymore and we can't take care of you? It's just very basic questions, but what it is, it's a form. And rather than you starting by having to ask these questions personally, people can go in and fill it out and share them with each other so that it makes it much less stressful and confronting. People kind of know where the others are in the family. And this site not only has, this how to get started with this form, it also has a kit, so it really has a lot of information that you could use to get started today. And this is the perfect time. A lot of people get together at Christmas with family. You could use that, send that out today, get started today, say, let's all work on this and just have a little conversation around to get our conversation started, when we're together at Christmas. Wouldn't that be nice? Because it's going to happen sooner or later. And, there's always the resource investigation that people can do. And I think a lot of people do that the minute that they hear a diagnosis, trying to figure out, what's going to happen down the line. And that's really important because education is so important. Know everything you can about the care recipient's diagnosis. Why? Well, because then you know about the prognosis. If it's Lewy body dementia, it might go pretty fast, a couple of years. If it's frontal temporal dementia, it might take a little longer. If it's Alzheimer's, I know people who've had Alzheimer's for 20 years, been in an institution. So it really makes a difference. I think the average for Alzheimer's is 7 years, but that doesn't mean it's, they're going to die in 7 years. What it means is it's an average. And I think I would really encourage you to go to the podcasts that Glenda talked about because of all the information that's there. Those podcasts are all given on different topics, many different topics, by experts on that topic. And Wilmer Charitable Foundation has done a wonderful job in making sure that the gamut has been covered for caregiver services. So here's your checklist. And you can print this, maybe just print this page out and go down it. And you're going to think, there's an awful lot of stuff here and it looks totally overwhelming. Where do you start? Well, where to start. I gave you that little cue. And I'm going to move right into connections and self-care. Why do we need connections and self-care? One of the worst problems for caregivers is isolation. And it's not just caregivers, because when caregivers get isolated, their mental health goes down the toilet. And so then what happens? Their care recipient feels it. Their care recipient acts out. They're both depressed. We've got to maintain our health, our functioning with diet, exercise, all the things that are good for us. We have to obtain support from family, from friends, from caregivers, maybe our church, whoever. We have to join support groups or chat rooms, so that we can really stay connected. And that's what's important, is that staying connected. And also, I encourage you, when I talk about self-care, Medicare and the 24 handbook, they have, I don't know, 30 different preventive services now. And it's mental health services, it's quit smoking, it's about counseling for obesity. There is so much there that's really valuable, and Medicare is willing to pay for you to get some education about that, which is pretty great. So here's the connections. Here's the way you can find connections. The National Institute of Aging, under the National Institute of Health, has a beautiful website, and it talks about loneliness and social isolation and how important it is to stay connected. And it has some really good tips and ideas on there. And for diet and exercise and medical care, the NIH has a lot of health information, and this is basically set up for the elderly. They did it in conjunction with the National Institute on Aging. And for, support groups, there's lots of local groups, there's national groups, there's online groups, there's chat rooms. You can get a hold of Elder Care Locator at eldercare.acl.gov. You use the phone number or the website, and also at the Alzheimer's organization. And they can tell you exactly what's available in your community using your zip code. So don't hesitate. Don't say there's no support groups by me. It may be that they're too far, and it may be that you can't get away because of your duties, but there's online and there's chat rooms. The chat room for the Alzheimer's organization, let's see, it's alzheimersconnected.org. And I'll send that one out too. There's a couple I revised, Glenda, so I'll send those out. And then prevention, that handbook. This is a link to an online handbook if you didn't happen to get one. And if you go on that and you want to print it out one, you can ask for it, and Medicare will send it to you. They're supposed to send them out to every Medicare recipient every year. And it will tell you about all the preventive services, what Medicare covers, what it doesn't cover. And I think, let's see, we're almost past open enrollment, but you got another week or so to go for open enrollment. In case you want to change your health plan, it also has the list of who's available within your zip codes and how you can make, the decision of which health plan to be a part of. And I bet you're all wondering why I put technology assist. Glenda, did you wonder?
Well, no, but I have information in my head about it. So
Okay. Well, it seemed to me really important, since all of you are on Zoom. I know you're all using technology. And so I'm thinking that we should really use that as caregivers and care recipients. Excuse me.
her allergies are acting up like ours are here in Texas.
Number one, you can stay in touch with that family, friends, and with the world news. And staying in touch with the family, once you start making a plan, is so important, because that plan's going to change all the time. Every time your care recipient gets a little sicker, or gets a little more demented, or gets a little more mentally out of it, you're going to be able to talk about it if you stay in touch with them. Now, these online support groups and mental health counseling, this is something that, you can use technology to really take advantage of. There's these MD video visits, telehealth visits, they call it, which is great, because if you're a caregiver, you used to have to wrap everybody up and go down to the doctor's office and wait in line, and drive there and drive back home. Well, now you can just schedule a video visit unless they need to do something important. And those video visits are supported by a lot of new telehealth technology. They have the online, and this is not in the doctor's office, but there are reminder systems for taking your medications, for health routines. A lot of you may have a Fitbit which is part of that technology, it will tell you, oh, look, it's noon. It's time to take that medication. It's 4. It's time to take that medication. Those things really help. And then there's the one that says at 7 a.m., get up and go for a walk. And that's really good too. And the other thing that's happening are medical devices at home. And these are this is wireless technology through your what do you call it? The router. And what the doctor has, and many of them are using them now, they have scales, they have glucose monitors, they have blood pressure monitors, they have oximeters that are all, put your finger in that little oximeter at home and measure it, and it goes right to the doctor's office. So then you don't have to go in. With the blood pressure machine, you don't have to go in and get your blood pressure measured. And these things would really help you as caregivers. And of course, with your phone, FaceTime, Skype, Zoom, Microsoft Teams. What else is there, Glenda?
Well, I was thinking about the watch because, I have a friend that has tachycardia. And so she has the watch, I guess it's the iPhone watch.
Uh-huh.
So it sends in a strip of her heartbeat to her doctor real time. So
Yay.
yeah. And so that's watches now are doing just a whole lot of things that more than telling time.
So that's why technology is important. And here's some websites. And these are pretty interesting websites. Because when you think about technology, you think about, well, where would I go to find any information that would be relevant to me regarding technology as a caregiver? Well, NIH has that. Go on that first one there. It's pretty interesting. AARP not only has that, but it has technology training. It has a resource. Remember what the whole thing stands for, but it's older adult technology something. It's OATS is the acronym for it. And they actually help train people on how to use the phone, the computer, what they need, the kind of help that they might need and the support that they might need, to use technology effectively for themselves. And then AARP also has this very interesting article on the last website here. And it's about brain health. And it's about all these, really sophisticated doctors, social workers, people who come, experts who come together and talked about how important it is to keep our brain health and how we do that, how we might do that. So you might want to check that out too.
And the technology, before you move on, Dee reminded us, and those watches also monitor falls. They make automatic calls if you have fallen, and there is no movement. So that's it's all right there on your arm.
Right. And that's great. And it goes, all those calls go to like 911. It's so
right.
important. Yes. Okay. I'm sorry I'm going so fast.
You're doing fine.
Okay. Why you need legal planning? Well, there was present a podcast just last week by a lawyer, and it was all about, who's going to make decisions for you when you can't. And you may be able to talk to the family about it, but how do you make sure it really happens? So doing the planning part of saying, all right, I want my brother John, to make my decisions if something happens and I can't do it. But just saying that and not writing it down and not making it legally official is not the same. So somehow you've got to get a will, do estate planning, advancce care directive, and you can do that either with your state attorney or there's general or websites. Nursing homes cost up to $100,000 a year, and the average caregiver spends $10,000 a year out of pocket. That's average. So some people who might be in the beginning stages of caregiving are spending much less, but some people who are in more of the end stages, they're buying respite, they're paying for a caregiver to come into the home, maybe 24/7. It's extremely expensive, so we have to have a plan. And part of that plan, talk to the family about, legally, how are we going to do this? Where are we going to go here? And we'll talk about getting resources to help you out. But that advanced care directive, that should be on your chart, your medical chart. So every time you see the doctor, go into the hospital, they have a copy of that, because that's where you do a DNR, do not resuscitate. So if you go in, if you had that slip on the floor, had a stroke at the same time at that grocery store, the medics come and they take you in, and you go to the nearest hospital, and it's hopefully the hospital that you always go to, since the nearest one. Then there's a record of your advanced directive in your medical record. And that's really important, because if you don't want to be resuscitated, it really is awful to have them resuscitate you, and the family have to come and say, she's a vegetable, unplug her. I mean, it's a tough place to be in. And there's also the power of attorney for health and finances. And that is much the same as, when you write that advanced care directive, there's many of the same things that cross over in that form. And this is where you can get help. Elder Care Locator, it's eldercare.gov, can help you find the least local legal services. Every area agency on aging, and Glenda can talk to this, they not only have a caregiver specialist, but they either sub out or they provide senior legal services with free assist. Now, these are generally paralegals, but they can help steer you in the right direction. They can provide forms for you. And if you need a lawyer, they have lawyers who generally either do, what's the free work? They do free work for you, or they
Pro
do,
bono.
thank you, pro bono work, or they do it at a low cost. So it's really, do you want to add anything about area agencies on aging, Glenda? She used to be a director.
Yeah. They're a really well hidden asset to this country's caregivers, because they were mandated by the federal government and given funding in order to specifically help caregivers. So I think it is a wonderful resource for all caregivers. And even if you don't have anything specific, I think I'd hook up with the area agency on aging in my area, just to find out what they can offer. And also they do education programs too, and that's helpful. So I just can't encourage you enough to hook up with the local area agency on aging.
Great.
You can get to that number by Elder Care Locator or 211 probably for your area.
Thank you. And there's also, for these forms, the free advanced care directive form and the power of attorney for health and medical care. You can actually go online. And if you have it, if you fill it out and you sign it and you have a witness, these are legal forms. So
One
don't
thing I'd like to say on that, Evelyn, sorry to interrupt, but I was on that session on the 15th with Mr. Bose. He's an attorney out of San Antonio. And he said, if you're going to use those online forms, be sure that they are acceptable in your state, because state laws and requirements are different. So that's just a little, heads up for you. I'm putting in the chat box the name of that session, so you can look for it as a podcast and that's another resource for you to get more information on advanced directives and power of attorney forms. Thank you, Evelyn.
Yeah, thank you. Yeah, a lot of these websites that I've talked about actually have you put in your zip code so that they know exactly where you are and what's going to be legal for you, or what is going to be financially available to you, especially in terms of public services. So, speaking of financial planning, caregiving is expensive. People who need long-term care, 40% of them die broke. Don't let that happen to you. Project your costs based on the prognosis. And as I said, it's different for every diagnosis. And dementia, of course, increases the cost significantly, because there often comes a time when supervision is needed round the clock. And no one person, no one caregiver can do that. That study from the New York Times and Kaiser Foundation. It basically really, one of the headlines was Medicaid drives people into poverty. And I'm going to give you a resource to find out what Medicaid pays for in your state. And it's really important that you look on that. I think it's on the next page. Yes, Medicaid eligibility by state. Then it gives you a map with all the states on it. And if you press on your state, it will tell you what the eligibility requirements are. And let me tell you how important it is. 2 years ago in California, on Medi-Cal was our program here. 2 years ago, the state decided and the legislature voted to raise the eligibility requirements, or to change the eligibility requirements. As a single person, you still can have, I think, $2,000 income a month, but the assets used to be $4,000 a month or $3,500 a month. The assets are stable, so $3,500. Well, they changed that. Assets are now $132,000 for Medicaid eligibility in California. So many states are looking at the fact that Medicaid drives people into poverty. And especially, the other thing that you need to check out when you go into the Medicaid programs in each state is if you're looking at nursing homes, many states have something called the spousal impoverishment law. And the spousal impoverishment law states that there needs to be an analysis of what the caregiver needs to continue living in the community in the same way they've been living in the community, in the same house, with the same car, with the same, activities. And then they pay for what they need in the skilled nursing facility. Now, the skilled nursing facility gives the patient $50 a month or something like that, $60 a month for little necessities. However, it may be that there's enough income, like these people who have $132,000 in assets, they may have a little bit of income over the Medicaid eligibility, for the person, because they separate the assets to do the spousal impoverishment. And it may be that you still have to pay some of the amount that comes in on a monthly basis from income toward the nursing home, but Medicaid pays for the rest. So be sure you look at that spousal impoverishment law and see if your state has that. It's really important when it comes to nursing home care. Now, for prescriptions, many people who, are caregivers have a terrible time with the cost of some of the prescriptions. And there is a program called Medicare Extra Help Programs. And I've got a link here for that. And you can look it up. There's a couple of different levels depending on your income. And what it does is it helps with the expenses above and beyond Part D. So you might want to take a look at that if you're having trouble with your drug costs.
Evalyn, some people are having trouble hearing you, so could you speak up some?
Yes, sorry. Am I
There
talking
you go. That's
too
better.
fast? Am I talking too fast too?
Well, nobody said that, but they just couldn't hear you. So they're trying to adjust volumes, etc. And I can't find any way to adjust your volume other than
Sorry.
ask you to speak up, please.
Yeah, I just moved my microphone closer. That'll probably help. And I can answer any questions at the end that what they didn't hear. I want to talk a little bit about personal care services. Now, every state has Medicaid, and it's funded partly by the state and partly by the feds. And the differences are how much the state is willing to put into the program. That's what makes the big difference about how much service you can get. Well, personal care services is one of the benefits that they're required to provide, but some states do it on an extremely limited basis. Some states are very generous. California will give you 800, what is it, 600, 800 hours per month if you are totally disabled and pay for that caregiver. That very few states are that generous. So what's really important is to go ahead, call your Medicaid office, see if you're eligible for personal care. And sometimes if your income is a little over the limit and you're not on Medicaid yet, If you have someone who needs a lot of home care, the social worker will come out, look at your finances and say, you know what? If your person needs 20 hours of care a day, we can pay for 8 hours of it. And you might have a share of cost, but it will be, something that we figure out based on a sliding fee scale. So go ahead and ask. Always ask if there's a way you might be eligible for that personal care services program. Now, the local area agency on aging, and again, Glenda, you can help me with this, which is funded by the Administration on Aging. It is funded, it has a big umbrella of funds. Some of them are legal. They have an ombudsman program for the nursing homes. They have long-term care programs for people that we're talking about, for you, caregivers, and your care recipient. And what would really help is if you give your local AAA a call and say, do you know where I can get some respite care? It's personal care, same as respite care. They come in, they spend a couple hours, you can get a break. They may cook, they may do dishes. Personal care services can mean a lot of different things. They can help bathroom people if they're allowed to do that. So otherwise, that care is really expensive on an hourly basis. We'll talk a little bit more about in-home care. And then there's always help planning. The ARP site has a website where they really talk about how, caregivers need to do financial planning. And it may be for those of you that's your biggest bugaboo, that going on there kind of ahead of time and getting information on, how to separate stuff out, how to make a plan for the prognosis, how to stay with your head above water. You may want to see that site. It's a pretty good one. Oh, yes. And one of my favorites, emergency plans. Many of the long-term care planning sites don't really talk about emergencies, but having worked in the emergency room, this is really an important topic because there's always unforeseen crises, and it can be you, the caregiver, or it can be your care receiver. And I would just say that oftentimes the care receiver, if they're left alone and you're not prepared for emergency crews to come in and take care of them, or they don't have any way to communicate, like the medical alert stuff and, maybe a cell phone, or maybe they can't use that, or maybe they have the Fitbit. But oftentimes people who are caregivers can't afford those expensive telephone wristwatches. So it's really important to make this plan. Now, it may be that hospitalization with or without rehab is needed for either one of either the caregiver or the care receiver. And again, this is a tough one because if there's hospitalization and rehab follows, then you know that the time that help is needed is going to be much longer. If it's the care receiver, and then if it's the caregiver, it's going to be much longer than just the hospitalization period. So it's really important to consider, the time you're going to need help. And if you're the caregiver, again, who will provide care and where will they provide it? Does a person have to go to a nursing home? Do they have to go to an assisted living facility? Is adult day health care going to be enough with the daughter coming over at night? All those things need to be part of your plan, need to be, kind of thought about, talked about. And if the care recipient is alone at home, there's some stuff you need. You need a medical alert system, whether it's a bracelet or a button or the phone. You need the Vial of Life med list. And then there's many medication lists, but the Vial of Life is interesting because they train the fire departments and the medics, the paramedics who go out, when 911 gets called, and they look for, there's a tag you put by the front door, little poster, and it says, look in the fridge for the Vial of Life. And in the Vial of Life, you have the medication list and you have the form of who the providers are, what hospital the person goes to, all of the information that those emergency workers need, to try to do the right thing and to pass it on to the physician or to the social worker or to the nurse when they get to the emergency room. So all of this stuff can really help you feel more secure that, if something happens while you're out of the house, or if something happens to you, that you're prepared. And there's also info sheets, where you have all this information, including insurance. And then again, make sure that you plan for a realistic recoup time. So the medical alert system, boy, good luck with that one. The top 10, there's so many people vying for your medical alert business, you won't have any trouble finding somebody. This top 10 thing just says that, they subjectively picked out the ones that they liked the best. But in case you need a referral, you can go there. The Vial of Life and Emergency Info Form is a website that has the information that you will need, if the emergency people come and pick up your loved one, or maybe your loved one has dementia, and they have to come pick up you because you've fallen down, so all of that information needs to be in that Vial of Life. Emergency preparedness. Now, this is a little off the topic, but, if there were an emergency, it wouldn't be off the topic. If there were a flood, or if there were an earthquake, or if there were a fire, it's really important to make sure that you have the stuff available that you might need with a natural disaster. In-home care. Okay, why would we need in-home care? Well, maybe you're tired, or maybe you just need help. You need respite. Oftentimes, especially with dementia, the care recipient may not want to leave the house, or you may not want them to leave the house, because changing the environment is one of the things that causes the most confusion. It disorients people. You may not be able to afford out-of-home care, so you have to have in-home care. But in-home care, oh boy, it averages $27 an hour, and many of the agencies who provide it, and you can go look at caregiver agencies, boy, I'll tell you, there's millions of them out there trying to help you out. But many of them have a 3-hour or 4-hour limit. So it's not that it's $27 an hour, it's over $100 a day. And that makes it, very, very difficult for caregivers and for the whole family. Or you may, as a caregiver, you may have an urgent need by the family, and you need to leave the house. Well, there might be a solution for that. Or if you have an emergency and go to the hospital or rehab, that would be a whole different solution. And we'll talk about the resources. Again, the Area Agency on Aging and eldercare.gov can tell you where to find in-home care. And I'm telling you, I had a difficult time, because every time I put caregiver in my Google search, I got 50 caregiver agencies in San Diego County. So they're there, and they're advertising, and they're on the top of the list. You want any problem finding them? Paying for them is a different one. And I did revise this. It's not the average $25 an hour. According to that article that I've quoted, it's $27 an hour for for reputable home care providers. The other thing you could do is trade care with other caregivers. I know people who've done that, and it's been quite successful. That Medicaid Personal Care Services program, you can find your Medicaid office through eldercare.gov. And hospice also covers some in-home care, and it's much more limited than it used to be, but it covers it both in your home until someone no longer can stay at home, and it covers hospice in that nursing home. So it provides, services in nursing homes. So it's important to know about those if you feel like someone is, getting to the end of their disease, or, they're dying from their disease. Now, out-of-home care is all right. And we all, we need to think about this. People don't want to think about this because, oh, no, not nursing homes. These are terrible places. They smell like urine. They don't feed you well. They're awful. Elliot Sklar, who talks, on the podcast many times, he talks about nursing homes and how difficult it is. But it's difficult for the nursing homes too. They can't find staff. They're not paid well. They get a lot of scrutiny from the federal and state government. But if you can't provide enough care and your health is diminishing from caregiving, you need to begin to think about nursing home care or out of home care, some kind of out of home care. Could be assisted living facilities if your person is not that ill and just needs some help with their functional daily living needs. Now, if you're really stressed and depressed and burned out, it's probably time to go and scoop out, what nursing home or what assisted living facility, might be affordable, might be a good match for your loved one. And when care recipients need too much assistance, and we're talking here incontinence care, lifting or transferring. I know people who've been sent home and they weigh, 250 pounds and their wife weighs 90 pounds and they send them home. As the social worker in the hospital, you go like, did they order a Hoyer lift? Did they show you how to use it? It's so difficult to when that discharge plan comes, when they write that discharge plan down, be sure you ask questions. Be sure that you say, I need training for that. Oh, I can't give shots. Lucy, our dear Lucy, says that they wanted her to give her mom, insulin shots, and she says, I can't do it. I'm not a nurse. I hate needles. I can't do it. And that's what you need to say. Just be honest. And they can send a nurse out to give those shots. Now, memory loss and wandering, when it starts with that and the problems of losing people, them getting lost, this may be the time to think about out-of-home care. And of course, end-stage disease. Many people who are suffering from cancer or from ALS, Lou Gehrig's disease, or from any of the many, really kind of quick killers, you don't have to keep them at home till the end if you're all alone. That 24/7, you can't do 24/7. Don't do 24/7. So there's adult day healthcare, and that actually, can work if you've got family in the community who can make sure that they're okay at night, can stay with them during the night. They can go to adult daycare during the day. There are assisted living facilities. And I want to talk a little bit about the Ombudsman program. Our Ombudsman program is funded by the federal government under the Administration on Aging. And they actually have an entire staff, mostly in area agencies in aging. And what they have is they have the entire MedicareCompare.gov website at their desk. And they put in your zip code and they can tell you where the closest nursing home is, how many times they've been fined by the government or by an agency that has to make sure that they're doing all the right things, what the reputation is from the phone calls that they've gotten. And there's a star system that they used to have, and that is under, it's being changed right now. It's out for public review, but they still have this Medicare Compare that not only is for hospitals and nursing homes and assisted living facilities and home health, but it's also for hospice. So, there's so much information on there that if you know where to look, you can find it. And if you don't know where to look, call the Ombudsman, call your local area agency on aging and ask to talk to the Ombudsman. They can also help you figure out what level of care your loved one might need because they're so familiar with what the rules are for these facilities. So to wrap it up, if you need more resources than this, there are the SOS centers in Texas, and there's the WellMed Charitable Foundation Caregiver Teleconnection website, which has all these podcasts. And we hope that you will continue to see the new presentations because they're always, experts on the topics. Or you can call customer service if you have a question and talk to our Minerva the Wonderful. She can direct you in the right, send you in the right direction. The Family Caregiver Alliance is not, they don't really take phone calls, but they have a wonderful set of fact sheets. Fact sheet on Alzheimer's, on frontal temporal dementia, on Lewy body dementia, all the different kinds of dementia, the difference between Alzheimer's and dementia. I mean, they have a lot of really good information. How to get ready to go to a trip on the holidays. I mean, that was the one I read, and I was astounded at the kind of detail that was in that. So that's a great website. Hospital social workers and discharge planners are the best. They usually know your community. They can help you and they can advocate for you. You know, if you tell them, hey, he weighs 250 pounds and I weigh 90, how am I taking him home? You know, and they can't say, oh, yeah, right. Okay, let me talk to the doctor. You know, so they can help you out. And those area agencies on aging, boy, you know, I keep coming back to that because as Glenda says, they are a little treasure, you know, for caregivers and for the elderly. And, you know, the websites that we looked at, almost all of them have additional information that you may want to look at. So start right now with that first website, send it to others, fill it out yourself, have a meeting at Christmas, and get started.
Hmm. You know what, Evelyn? It dawned on me you didn't ask your question in the beginning.
Oh, yes. How many of you have a long-term care plan?
Okay, go down to reactions at the bottom of your screen if you're on Zoom, and you'll see raised hands so we can count hands. Ooh, there's one. Okay. Oh, three. Yes.
Woohoo!
Yeah, I'm proud of you. Well, four. I am so proud of all of you because the horror stories we've heard over the years just make me know that you need to have a plan in place. And as Evalyn said, it's not in concrete, it's fluid. So you're going to be changing it as your situation changes. Chris says, will this be available for me to watch again? Great information. Dorsey, I knew you would have one. There was no doubt in my mind. We have sent this out. It was late, and I do apologize to you. We sent out a PDF of the PowerPoint shortly before the session today. Evalyn and I were talking, and she made a couple of revisions, and we decided it would be good for you to have as a hard copy if you would like to print it out. If you didn't get that, you can call our customer service number, 866-390-6491, and we'll make sure that you get that. If you want to watch this again, you can go to the Caregiver Teleconnection website, and that is www.caregiverteleconnection, all squished together, caregiverteleconnection.org. Or what we're hearing from our participants is they're going on YouTube, and you can look for the WellMed Charitable Foundation. You can look up the topic and it should pop up for you. So yes, you can watch it again. It does have a lot of great information. I saw that we had somebody on the telephone, so I wanted to backtrack just a minute. We were talking about a session on the 15th that I was on with an attorney who talked about who decide when I can't. His name is Brennan Bowes. And I would encourage you to also, as a follow-up to Evelyn's wonderful presentation, to go back there and look up that podcast also, because he had a lot of good information and a lot of warnings about how to do things. Let me see, Evalyn, will you be back on Wednesday with Natalie Oliver?
Tuesday?
Wednesday the 29th?
Oh, I have
Well, anyway, Evalyn may be there. On Wednesday, the 29th at noon, there's a session with Dr. Natalie Oliver. She's with us often, and she's a wonderful presenter, very warm and caring. Her topic is I love you, I don't want to hurt you. And she's going to be talking about elder abuse. And, you know, it's nothing that we want to talk about, but it's alive and it's out there. So, yeah. So I wanted to tell you about that. We have a few minutes here. If you have a question, comment, you can unmute your microphone. If you're on your telephone, you can press *6 and that will unmute your phone, or you can just enter something in the chat box. A lot of information here. Oh, Minerva put in the chat box the link to that session that I was talking to you about with Dr. Bowes, with the attorney, Mr. Bowes. He was really excellent. Out of San Antonio, Thomas, so he's around.
Glenda, I wanted to let people know too, there are two websites that when I went back and checked, they were not really the ones that I wanted. And one of those was for the Medicare handbook. And the one that you have there, that's a .org, that is not good. That is trying to sell you a managed care plan under open enrollment.
No.
Yeah, so I will send you a new one with the resources. The other one is the AARP chat room. That AARP has something called AARP Connection, and it actually has lists of online groups, and it has like a board, which I think also is a chat room. It's sort of the same concept. So I'll be
Okay.
sending those two revisions to you too.
And you had some other ones earlier on that I wrote down that I'll remind you about too. Cynthia, did you have a question or a comment? Or were you just raising your hand on the question that we asked about whether you had a plan? I guess it was just she had her hand up about the plan. Okay, well, we have 2 minutes left. No questions, no comments. I know it's a lot of information to.
Were there no chats for me?
There were not. There were wonderful chats that I had going on behind the scenes with various people, and was able to, I think, answer their questions. Other than
Thomas?
they really, I think, enjoyed that, and they want to thank you.
Thomas, did you have a question?
Yes, I did. I was wondering for myself and another relative that just joined the SOS, the Caregiver SOS, the support group for caregivers. Do they offer that for Zoom? Because I have a relative who's actually out of the country with his 90-plus-year-old father, and they're out of the country right now, but he's able to get on the internet. And I didn't know if any of those support groups are offered Zoom or are they all in person?
I'll be more than happy to answer that question.
Go right ahead, Minerva.
We do have support groups via Zoom, and we also have support groups in person at our SOS locations. We have SOS locations both in Corpus Christi, San Antonio, and down in the Rio Grande Valley. And we do have someone that does the virtual that oversees Greater Texas, El Paso, and Florida. So if they're interested in participating in one of the support groups, just have them give me a call at 866-390-6491. And I'd be more than happy to get them connected with one of our caregiver specialists. But yes, we even had people from Europe call in and participate in our support groups.
Did that help, Thomas? Oh yeah, thumbs up. Great. Thank you, Minerva. Well, I show it's noon here in Central Texas, and I want to thank Evalyn so much, as always. My pleasure to be with you. But thank you for this wonderful presentation and all this information. If you did not get the presentation, get in touch with Minerva at that customer service number, and she'll be sure that you get that. Final words, Evalyn.
Thank you all so much for what you do.
No, isn't that the truth? Yeah, bless you all. And have a calm holiday season. I think when our December calendar comes out, there are going to be some sessions that you can join in to kind of handle, the stress that goes along with caregiving in the holidays. So join us again. Thank you so much. It was my pleasure to be with you today. Bye-bye.
Thank you, Brenda. You're the best.
Bye-bye.
And Minerva.
Yes.
Bye.